Ladies and gentlemen, we are recording from the dialysis clinic at the dialysis center in Annandale. I am Dr. Doobay, and we started this dialysis clinic about 6 years ago. And the reason for starting this clinic is because dialysis was very expensive for patients. And we have brought dialysis down quite a bit. But at the moment, we cannot afford to keep the dialysis going unless you help us. It costs us $75 for a dialysis, to do a dialysis for a patient, and the patient can afford, maybe some can afford some money, some can afford no money whatsoever, and we have over 100 patients, and we are dialyzing, and we really would like to ask you, whatever you can give.
Doing dialysis for 5 years. I have 2 children. I'm doing dialysis at Doobay Medical Center. I like it here, but it's very difficult with the finances to pay. So I'm asking if we could have some assistance, some help for all the patients.
I am Marina Soldan, and I had a kidney transplant 2008. And my kidney did not last long. Now I'm at Doobay Dialysis Center, and I'm begging for any help as a donation to help out with the center, because it's really hard for me.
Being provided here. I'm almost in tears because without this service, many of us would have already died. I've been here 6 months now. Dialysis is very expensive, as we all know. I'm appealing to good hearts. Please donate to this center so that we can sustain the life of Guyanese. There are young people here from as young as 6 years old. We hope that by looking at this video, it will touch your heart and you will make some donation to this center. Thank you very much.
And I clearly remember my first visit in Guyana, which actually was at Georgetown Public Hospital. And I met this young Guyanese gentleman, about 26 years old. So this gentleman comes to me in clinic. He presents with me with high blood pressure, and he brings me a piece of paper that has some blood work that he had done. And that really showed that he had significantly advanced kidney failure. At this time, there was no dialysis therapy that was really being offered to these poor patients. I assessed him, and he had absolutely no idea how advanced his kidney failure was. He told me he was married with a 4-year-old son, and his wife was expecting. He worked in construction, but only when employment was available. He was barely making ends meet. I told him he had advanced kidney failure and that he would require dialysis as his kidneys could not recover. He looked at me in a shocked state and told me that he could never afford this. He then asked me in a desperate manner as to whether changing his diet or perhaps taking a drug he could afford would help his kidneys recover. I remember that moment, staring at this gentleman as if it was yesterday. My eyes actually became watery as I said, "No, there isn't anything." I knew the next question he would ask, and he did. "So, Doc, what can you do for me? Please help me." Never have I felt so helpless in my life as a physician. That man left that clinic that day, and he probably went on to die over the next few weeks, leaving his son and his future child fatherless and his wife widowed. We all have life-altering moments, but that was certainly one of mine.
For the 5 years I'm taking dialysis, I get 3 children. I depend on my children and to help me, and I got a family to look after. I'm a beg for help. I'm more than grateful if anybody can sponsor me and to help me. My husband passed away and he left me alone. And thanks anybody who want to help me. I'm more than grateful. Because when I get nobody, I get 3 children, I got a family, they got to look after them. And then getting children, sometimes they got to share them children, something to give me help. And it's very hard. It's very hard because plenty day me don't come with money. And I'm more than grateful if anybody can help me. And so anyway, thank you very much.
Mr. Wallison here, he's a patient of Doobay Medical Center for the past 6 months. Currently, he has been receiving oxygen because he's been having shortness of breath, and that's because of the lack of dialysis.
I'm glad that media person can come and know what's going on with the patients here. It's kind of hard coming all the way from Borbis.
So friends, this is what we are doing here at this center, and we are appealing to you to please help us with your kind donation. If you help us with whatever little you have, you'll help to save a life for these patients. They are traveling very far, they're coming for their dialysis. Some of them cannot afford even one dialysis a week, which is a death sentence. And at the end of this video, you'll see how to give your contribution, and all your contributions in North America is tax deductible. And if you are in the West Indies, you can send it directly to the Doobay Medical Center. You can see it on the website, and give it directly to them, and they will give you a receipt. I thank you very much. And here's our chairman now, Mrs. Gafoor, who will say a few words.
At the Doobay Medical Center, we attract patients who are not able to go to the high-price centers. We need your donation more than ever. We are very, very grateful for it because we are able to keep these patients in treatment and prolong their life and less mortality. Thank you.
Dr. Doobay has taken another big job, big service, opening dialysis center in Guyana. People don't get this facility in that country, so they die. But here, somebody is going to help them because of you people's contribution. It's not possible just done by him. We need your support. And I'm more attached to this cause because my wife takes 3 times dialysis a week. So I know the importance. This is the helpline one can live if dialysis centers are there. So I'm very grateful to you all and of course Dr. Doobay, his team, his friends.